Quick facts, page 18. Classification of burns. First degree burn, superficial partial thickness. Skin, pink, red, painful, like a sunburn. Second degree, deep partial thickness. Skin, red, white, blisters, swelling. Third degree is a full thickness. Skin, black, brown, edema, all layers of skin burn, grafting needed. What is the formula used to determine fluid replacement for 24 hours? Is the Parkland formula, which is you do 4 milliliters of lactated ringers times the weight, which is kilograms times % of body burn. How much of this fluid do you give in the first 8 hours? Half of the total volume. And then in the second 8 hours, you give a quarter of the total volume. Then the third 8 hours is a quarter of the total volume. So half is given in the first 8 hours, the other half in the other 12. It's 24 minus 8, 16 hours. Should you burst a blister? No. What is the best route for pain meds? IV. You want high calorie, high protein diet for burn patients. Common electrolyte problem with burns is low potassium, hypokalemia, or hyperkalemia. So it can be high or low potassium. Both can be seen in clients with burns. Prolonged stress puts them at risk for curlings, ulcers, stress ulcers. Pain medication should be given before dressing changes. Moving on to cancer on page 19. True or false, cancer is abnormal growth of cells. It's true. Metastasis is when it travels to a different origin. Acronym, caution. For cancer, no. C, change in ball or bladder. A, any sore that does not heal. U, unusual bleeding, discharge, thickening in the breast. For T, indigestion. For I, O, obvious change in wart, nagging cough. N, for or hoarseness. Tumors are described by grading or staging. Grading describes a tumor by the cells. Staging describes the progression of tumor by the clinical symptoms. 3 types of radiation treatment are external unsealed, internal sealed, and internal. Precautions. Private room, bathroom, limit visitors, rotate nursing staff who provide care, place sign at the door and bedside. Most dangerous type of radiation is sealed internal radiation because a solid radioactive implant is placed inside the tumor. Additional precautions to be taken for sealed internal radiation is all body fluids are radioactive. Use hazardous cleanup gowns and gloves. If a client's sealed implant falls out, like a cervical implant, pick it up with a long handle, forceps, and put it in a lead container. Chemotherapy works by destroying the cell wall. Side effects of chemotherapy: nausea, anorexia, alopecia, sterility, decreased bone marrow and platelets. To reduce nausea, Reglan metoclopramide is used to reduce nausea. The medication called metoclopramide, which is known as Reglan. Alopecia is not permanent. It's temporary from chemo. Sterility is permanent from chemo. Clients with cancer also need neutropenic precautions, which are strict hand washing, no visitors that are sick, no children, no raw food, no live plants, or no freestanding water. Neupogen, filgrastim, is a drug used to treat neutropenia, so monitor their WBCs. Best time to do a breast exam 1 week after your menstruation. When is the best time to do a self-testicular exam? The same day each month. If a client has a mastectomy, can you take a blood pressure on the affected side? No IV and no blood pressure if they've had a mastectomy. Other post-mastectomy patient education tips are to elevate affected arm, no initial exercise after surgery, encourage discussion for positive self-image. With car seats, you need to know that if they are under 4 years or under 40 pounds, if no back seat, do not put baby in the car. Signs of cataracts are milky white lens, painless blurred vision. They're treated not until it's severely impaired. Surgery are they're removed and a new lens may be implemented. Vision's corrected only if a new lens is placed. If no lens is placed, the client will need glasses. Contacts after surgery. Check for hemorrhage of the eye. Place client in semi-Fowler's position. Page 22, quick facts. We're moving on. What do you tell clients to avoid? Coughing, sneezing with cataract surgery, bending over the waist, straining, rubbing eye, or crying. No lifting greater than 5 pounds. Sleep on unaffected side, or if surgery was on both sides, sleep on back. Use eye shield at night to protect eye. Celiac disease is malabsorption of fats. Foods containing gluten must not be eaten. What foods contain gluten? Barley, rye, oats, wheat. B for barley, R for rye, O for oats, W for wheat. Client's abdomen is often distended. What does the client's stool look like? Smelly, pale, bulky. Expect lots of gas with some diarrhea. Best food substitutes are corn and rice. CVA, cerebrovascular accident, stroke, is a reduction of cerebral blood flow and oxygen causing brain cell damage. Most common cause is embolism, hemorrhage, and thrombus. Signs of a CVA are headache, nausea, nuchal rigidity, hypertension, slow bounding pulse, kinase, strokes, respiration, speech changes, facial droop. TIA is temporary period of neurological deficit. It has similar signs as a CVA, but the symptoms will also resolve. Transient ischemic attack, which is different than the actual CVA. Agnosia is inability to use an object correctly. Expressive aphasia occurs when a client cannot communicate properly. Aphasia can be expressive or receptive. Left hemisphere affected, stroke will weaken the right side. Right hemisphere will affect the left side. Remember to place the client's belongings on the unaffected side. Tests used to determine CVA are CT, EEG, and the cerebral arteriography. Assess vital signs, neuro checks, watch for seizures, monitor for increase in cranial pressure, check ability to swallow. Finishing CVA here, we have on page 24, what complication of the eyes can a client with CVA have? Corneal abrasions because lacrimal glands will not produce secretions. Activity level would be strict bed rest. Room environment should be quiet, peaceful, with objects within reach on unaffected side. Position the CVA client. Turn every 2 hours on unaffected side, 20 minutes on affected side. Make sure to elevate affected extremities. A thrombolytic would be given to dissolve a clot. Do not give for hemorrhages. Other medications for CVA are antihypertensive, anticoagulants, not for hemorrhage, stroke, and anticonvulsants. Do anticoagulants like Coumadin and aspirin dissolve clots? No, they thin the blood. They do not dissolve clots. We'll stop right there at COPD and finish page 24 next.